That makes a lot of sense. So I guess, I mean, that leads me to my next question, and this was kind of embedded in a lot of the different questions that came in. So I'm going to ask kind of a summary question. Um, so this is from a parent, from someone who has a child here in San Antonio. I've seen some videos online with people who say they are doctors that question the vaccine and question the safety of the vaccine. Specifically, I've seen that the vaccine could lead to infertility. It could lead to trouble with my daughter's menstrual cycle. It could lead to a lot of different effects. Can you talk a little bit about, so A, can you talk a little bit about that specifically? And then B, like, how do I know who to trust? When I was growing up, there were not a lot of videos online. I couldn't just like pick out whatever. I think our children, I have two children, you have still a young child. I think like we're living in a very different era where access to videos is very easy to get your hands on. So can you talk a little bit about the first part, which is just like some of the misconceptions associated with this specifically, and then how do I know who to trust who's online?
So let me address the infertility question, because I think that's one that it's in some people's minds, obviously, because they ask, and there is no evidence that it causes any female infertility. Now, there is some evidence that when your immune system is being revved up, your menses, your menstrual cycles may change a little bit for a couple of times, but that doesn't mean that you're going to be infertile or connected. So for female infertility, there's no evidence that has been shown, or there's nothing to support that. On the other hand, the infection of COVID on males have a particular effect on their fertility. So males who get infected with COVID are potentially going to have impaired fertility. So I think that that's another reason to get the vaccine, just to prevent that. So if you are concerned about fertility, it's very important to get the vaccine as soon as possible. As to who to trust, just because someone has an MD or a DO or is a doctor, it really depends in what area you're studying and what is your area of expertise. I work at the Health Science Center in the School of Medicine, and we have infectious disease specialists. We have people who have a special training in public health, and they understand and they provide. And it's really, those are sort of the experts that can give you, and people who study viruses, virologists, they are people who know what's going on there. Anybody else, you need to know who they are and what they have. So what to trust? I would say if you're in San Antonio, if you're in Dallas, if you're in Houston, trust the medical schools that are there. Chances are, I mean, I know that for San Antonio, we are very proactive in getting on TV, on the radio, in getting information out. And I think that that's a good source. So if you are getting your information from a place where future doctors get trained and it's coming from people who have expertise, that's probably the best source. The other source is maybe you have a doctor or you have someone you trust in that sense. I think they may be also potential opportunity. They might be sources that you can trust. But just because somebody out there said, you know, the sky is purple, it doesn't mean you have to believe that the sky is purple because that person is a doctor. I think that that's an important piece to keep in mind. And the reality is that many of the people, particularly the people who are pushing for disinformation, and they are killing people, frankly, because they're giving them wrong information, but they also are profiting from that. They may themselves be vaccinated, but they refuse to answer that question, and they are getting profits from that. So let's not get abused by that, and let's get to the true source of information.